Hello, my name is Samira Vasquez, and today I will be informing my audience on the effects of cannabis withdrawal. What is cannabis? We can discuss the effects of cannabis withdrawal without first discussing what cannabis is. Cannabis itself goes by many names, such as marijuana, weed, pot, bud, ganja, chronic, and herb, just to name a few. Cannabis has been around for over a millennium, but its uses actually began as medicinal. As time went on, the substance made itself to the United States, and its uses transitioned from primarily medicinal to recreational. What is cannabis withdrawal, and what are some symptoms? Cannabis withdrawal is a disorder that is still relatively new to the DSM. Cannabis withdrawal can be described as a disorder that occurs when a prolonged user separates themselves from the substance and essentially goes cold turkey. No drug comes without its fair share of symptoms. Some withdrawal symptoms of cannabis can include, but are not limited to, nervousness or anxiety, irritability or aggression, restlessness, weight loss, insomnia or unpleasant dreams, and loss of appetite. Not only this, but it can cause a wide array of physical symptoms such as abdominal pain, shakiness, tremors, sweating, fever, chills, and headaches. One of the most positive treatment options to help combat these negative withdrawal symptoms is oral synthetic THC and contingency management. When Withdrawal was tested, scientists found that low dosages of oral synthetic THC worked better in comparison to a placebo. It proved successful because it gave the body what it craved while also separating it from the real thing. It also proved to have less withdrawal discomfort symptoms with every dose. Another successful option for those with a little more self-control is contingency management, which can also be described as patient conditioning. When a negative target behavior happens that needs to be diminished, in this case it would be cannabis usage, then a negative reinforcer is used in order to diminish the behavior. When a positive target behavior happens, in this case it would be not smoking after a trigger or reactant occurs, then it would be reinforced with a positive reinforcement. Unfortunately, this treatment option was not as successful as Withdrawal, and only 19% of the participants in this study were still abstaining at the yearly check-in. In conclusion, regardless of the less positive treatments, the most important takeaway is that treatment options do exist. If an individual does find the strength to want to quit, they should not be forced to suffer in silence. Addiction defines no one, and the decision to quit is the first step towards the road of release, healing, and new self-discovery without addiction in the rearview mirror.